The summer sneezes are coming sooner and lasting longer. Climate change has prolonged pollen season and with it, misery for hay fever sufferers.
But as we said, hay fever sufferers, it isn't great. And certainly today, high pollen levels across the south, medium or low elsewhere. Back to you both.
OK, Matt, thank you very much indeed. Let's stay with that right now.
Yeah, because if you've been suffering from hay fever this year, then you are certainly not the only one. Symptoms like itchy eyes and a runny nose are thought to affect up to 15% of children and 26% of adults.
It's also more common than it used to be, apparently. Scientists estimating that cases have trebled over the last 20 years.
And this could be the reason. A new report has found that the pollen season is being prolonged by climate change, which means sufferers are likely to experience symptoms for 2 weeks more than they did in the 1990s.
Let's speak to Professor Adam Fox, who's chair of the National Allergy Strategy Group. Good morning to you, Professor.
Good morning.
Does this make sense to you?
Sadly, it does. It's a familiar picture, and we've seen over the last few decades a real rise in allergic disease. You mentioned there a trebling of cases, actually, of anaphylaxis attending emergency departments in the last 20 years. We've seen food allergy doubling in the last 10 years. But of course, the most common allergy of all is hay fever, and it affects a very significant part of the whole community.
So it's really interesting. We're finding out now that potentially climate change may have an impact and affecting people for 2 weeks longer than just in the 1990s.
That's right. I mean, what we're seeing happening is pollen seasons are getting longer. The peaks of the pollen seasons are getting higher. We're also finding that the geographical spread of pollen is getting wider. So if you've got a pollen allergy, then you're more likely to suffer. You're more likely to suffer more severely, and you're more likely to suffer for longer. And all of those things are obviously really bad for hay fever sufferers.
Fascinated to see that you've launched this National Allergy Strategy, which says that the UK has some of the highest allergy rates anywhere in the world, why would that be? I mean, every country has got trees, every country's got pollen. Why would we suffer from hay fever particularly badly here?
I don't think it's so much about the pollen or the actual allergen being around. It's more about a whole range of factors. In fact, really many of the things that what make Western societies what we are seem to promote an allergic tendency. And our understanding more recently is that the way that many factors like diet and environment influence our gut bacteria, what we call our microbiome, seem to be increasing our tendency to develop allergic responses to the outside world. And as a result, we've got this huge amount of allergy here, and frustratingly, and certainly compared to other developed healthcare economies, the provision of specialist services and in fact even knowledge amongst GPs, for example, at managing allergy is not as good as it could be.
Yeah, and I mean, hay fever for many people is quite mild, but actually for quite a lot of people, the symptoms can be really serious and life-affecting. We're thinking about particularly students going towards exams. It's really difficult, isn't it? And in terms of the support for people with an allergy like hay fever, you know, what provision is there in the UK?
You're exactly right. For most people, it can just be a little bit irritating. But for a significant minority, this is a real problem. It has a genuine impact on quality of life. It impacts productivity at work. It impacts school performance. There's studies showing that you're more likely to drop grades from your mock exams to your summer exams, which are in the pollen season, if you've got hay fever. Now, there are treatments available. You can go to your chemist and get saltwater nasal sprays, steroid nasal sprays, antihistamines, and all of those help. But for people who've got more severe disease, there are specialist treatments, for example, desensitization or immunotherapy treatments that are licensed. They're approved by NICE, which is the organisation that recommends things to the NHS. But despite that, access to these treatments is really, really limited. And that's because there aren't enough allergy services around. There's not enough knowledge about allergy within the NHS. There's a big training gap there. And so the people who need the treatments, even though they're approved, just aren't getting access. And that has to change. And that's something that's really central to our national allergy strategy.
So until there is change, what's the situation at the moment? If somebody's really suffering and the over-the-counter stuff isn't really touching their hay fever symptoms, what they do, they go to the GP and try to get referred?
Yeah, I mean, I think it's definitely worth going to your GP, talking to them about it. They can look at NICE guidelines, which are very, very clear that people with severe hay fever that reach certain criteria, they're on the right medication, it's not doing the job, they should have access to these specialist treatments. Waiting lists still frustratingly long. There's a very small number of allergy specialists to get referred on to. It is possible to access it privately, but that's not how people should have to. They should be able to get it through the NHS. And so we're now working hard as a whole allergy community, coming together around this strategy to lobby the Department of Health, the NHS, to start doing better when it comes to provision of allergy services.
And just a final word, Professor, we've talked about the fact that the situation seems to have got worse since the 1990s. Bearing in mind all we hear about the climate, are we expecting this to get worse again?
Well, there's a number of allergic diseases where the prevalence does seem to be levelling off, which is good news. So we're not in an inexorable rise, but probably a slow and steady climb. So sadly, yes, the forecast doesn't look great. OK, Professor Adam Cox, really good to talk to you, Chair of the National Allergy Strategy Group. Thank you.